it's Jessica DaMassa with WTF Health, and I am here at the Connected Health Conference, and joining me right now is none other than the infamous, the fantastic, the wonderful Mr. Matthew Holt. He is Bolty Boy on Twitter. He is the president of SMACK.Health, the founder of SMACK.Health. He is the founder of Health 2.0, and he is my co-host for Health Technology's favorite 2 minutes of question and answers, Health in 2.0. Matthew, always a pleasure to talk to you.
Thanks, Jess. So we got time for the interview now? Done the introductions?
No, thank you for watching. No, so we actually have to have this interview because I want you to break down something that you talked about on the main stage at Health 2.0, because I feel like you and Indu, in your keynote, started to talk about this idea of flipping the tech stack in healthcare. And I want you to break that down for everybody who is watching, and also those who were at Health 2.0 and maybe need a refresher on what this is.
Sure.
So talk to me about the tech stack. What is it? Why is it flipping?
Okay, so there's a bigger stack. It's not just a tech stack, right? Okay. So there's a three-layer cake that is flipping and changing in the healthcare, and it really explains what's going on in the wider world of technology and how that's impacting on care delivery. So we started out with care delivery. That's the first thing. We've had care delivery for thousands of years. A doctor and a patient come together, a witch doctor and a patient or a villager or whatever, all get together. That relationship has been physical in one place in general for a long time. Okay. We've built a group of organizations, institutions around that, doctors' offices, hospitals, a bunch of others. Then we started adding 15, 20, 30, 40 years ago, service layers on that. You can think of things like nurse advice lines, some of the things that health plans do to try to manage care. But they've been added, sort of an additive layer of services. Okay. About 20 to 25 years ago, and most in the last 10 years, we added a bunch of technology across the top of that to track those services and track that care delivery. The biggest emphasis of that has been putting EMRs into the enterprise, the growth of the Epics, the Cerner's, the Meditechs, the Athenahealths of the world over the last decade, more or less. Okay, so that's all well and good, but really what we've done is we put in place the care delivery platform that we've had for the last several thousand years, which is based around face-to-face visits. We've done some other stuff around the sides, but we haven't really figured out how to use technology as a whole other than to track what we've got. Now, flip to the rest of the world, the rest of society, and obviously technology has completely changed. We use technology in a completely different way than we did 10, 15 years ago, and we use these large things that the SMACK.Health stuff to talk about, these large-scale cloud-based technology services, which are now adding more and more applications on top of them, which have a lot of self-service components and allow you to plug in new applications, new devices all the time. Okay. So what's starting to happen in healthcare is that the stack in healthcare, which has been care delivery with services with tech on top, is starting to flip. This tech layer is getting bigger and bigger and bigger. Okay. It's not just electronic medical records tracking what's going on in those visits anymore. We're starting to add all kinds of services. And there are actually 5 component parts that we've identified as being breaking out from that sort of solid tech stack. So the 5 component parts are starting with data storage. We have all new kinds of ways of doing that, new kinds of databases, blockchain, and new technologies for that. Blockchain being one of many different options for that. There's an independent now transaction order layer, which is the most of what's going on in the current EMRs, ordering, supplies, notes, tracking transactions. Okay. Third layer is data exchange. We now have got a bunch of specialist companies to helping move data around, which has been a big problem for those siloed EMRs. Fourth one is data analytics, a whole bunch of new companies adding the analytics capacity to look at all these new different types of data sources and try to figure out what is going to go on for most people, what types of care have what impact, and what kinds of patients may have what type of disease in the future. And the last one is a whole new bunch of interface layers, which are, some of them, there's a voice conference here at Connected Health. There is obviously people using Google Glass, trying to use augmented reality, different ways to connect as opposed to just typing into the computer. So all this technology is going at once in that tech stack alone. But underlying all of this is essentially we're building, slowly but surely, a always on, always monitoring, always messaging, and always managing tech platform. Okay. So our view is that is actually going to take over most care. Most chronic care, most acute care is going to be by people accessing that the way they access Google, they access Apple now, and plugging into that. And what's happening in the home all the monitoring and measuring that's going on in remote monitoring, remote care in terms of stuff that's implemented in the bathroom or the Alexas and the Google Homes of the world, are going to be tracking more and more of that. And we're going to start, those technology platforms will start to build the tech services on top of them, which is usually coaching nurses and others, connecting with people who have needs and helping them with that. And then we're going to limit care delivery, the face-to-face care of people in institutions on top of that. So we're going to essentially flip the original stack around, where care delivery is going to be the last thing you get to after you've used that entire program. So that's what we mean by flipping the stack. And we are some way to start in that process now in healthcare. It's a big, complicated change, but all the technology you see in the hall here at Connected Health or that you see at Health 2.0, as compared to the more enterprise stuff that you tend to see in the main hall at HIMSS, is going to enable that driver.
Okay, so put this into context about what's going on broadly in healthcare right now. So we've seen, some examples of some companies that are, it almost feels like taking this tech stack idea and really like driving it home. As we've seen just recently, Devoted, Medicare Advantage raise a ton of money. Companies like Livongo, SMACK.Health, also just being and doing what you're saying, kind of taking that, providing that first layer of care. So, how are they? Is this the beginning of that stack flipping?
Yes, I think so. What they are doing is those kinds of companies, we mentioned Livongo, Armada, are somewhere in that services business. Now, in Devoted's case, they're going up and down. They're all developing a technology layer, which will plug into a bigger technology layer. I think the bigger technology layer is coming from those bigger vendors, those tech giants we talked about, and others. But what they're doing is basically creating a technology layer that's going to monitor and manage most of the chronically ill people they're working with. And then by exception, there'll be time when you need coaches, you need services, you need a plug-in to your technology. So take Livongo, for example, company we looked at a lot. They've now, just in the diabetes space, they've got a tech stack of their monitor, the cloud-based analytics about what's going on. And then if you have a problem, they'll have a nurse who'll call you, who's part of that service layer on top of it. Now you can imagine Livongo as being one part of a much bigger tech platform that might include mental health and all the different disease states required of that. So they're one example of that. Devoted is interesting because they're going all the way up to adding the primary care part to manage. So they're doing a data play as ALDA and some other companies are. Many of these companies funded by the way, by the folks at Venrock who think about this a lot. So can you build a system where you are now essentially building a new tech integrated platform all the way up and down the scale, including having clinicians at the top to intervene when necessary. And I think if you were to go back to the origins of Kaiser Permanente, and Sidney Garfield from 1937 was going to start this again, he'd think of something like this. There just wasn't the technology available then. There wasn't really the technology available until now. And the struggle for the rest of healthcare is that that's not how healthcare is organized, right? We're organized in big institutions with doctors and us trying to figure out, and they're meeting a lot of patients, and that's not an effective, efficient way to deliver care in the future. So we're going to go through this wrenching transformation. But I think that's how those small companies, many of them who are raising these big amounts of money, are trying to figure out how do they build the platform, build the service layer, so they can actually do this and basically be the way that stack gets flipped.
So as you're talking about this, I'm thinking about like the vertical integration that's starting to happen like elsewhere, like with CVS and Aetna, or it's like you start to see like that Amazon, JP Morgan, Berkshire Hathaway healthcare entity. Is that the same thing, or is that a little bit different? Like, and how is that, if it's different, how is that going to impact the world that you're talking about here with this different healthcare tech stack?
It's all related because of the ability to do this with technology. In the end, everyone's looking at the same problem, which is that about 70% of costs come from what happens to chronically ill people when they're not in the hospital and they're not at the doctor's office. How do you manage that part well? So and then that's where who the costs come from. Now, where the money is spent is inside the hospital, right? So if you want to look at this and say, how do I save money and do care better? I want to manage those people in their homes, in their everyday lives better, and I want to not have it happen in the hospital. So you get something like a CVS Aetna, and maybe when an Amazon comes into this market with their purchase of PillPack and others, you can see the dots starting to appear as the picture comes into focus. What's going on there is, how do we manage these people and essentially take the hospital admissions away from where the things have gone wrong. If it went right in those chronically ill people's lives, they wouldn't have the emergency room with this, they wouldn't have the hospital admissions, they wouldn't have those procedures. And you can see that's eventually going to be very threatening to the big hospital systems.
Yeah, I was going to ask, so what are they going to do? I mean, do you think they're going to fight back? Is this where like data becomes like the war zone? I mean, like what's going to happen?
Well, it's a long-wrenching transformation, and the hospital systems...
So is all of healthcare.
Okay, sorry. And the hospital systems have got a lot of money, but we don't need as many hospitals as we've got. We don't need the systems that have done the horizontal integration of buying doctors, basically to fill their medical palace with referrals. That's not an effective use of the healthcare dollar. That's why healthcare spending continues to increase and is now, on the way to 20% of GDP and $3.2 trillion. So I think what's going to happen is that some of the hospitals are going to figure this out and say we are going to expand our market share to be. Some will say we're going to keep doing the best hips we are, and we're going to be better than the other guys doing hips, and some of the other hospitals doing hips is going to go away. Some of the bigger systems, I think here are the Kaisers, the UPMCs, those others are going to start thinking, how can we play in this and be our own vertically integrated stack? Kaiser kind of already is. They've got a lot of legacy stuff to deal with and get rid of. Yeah. But in that sense, you can see some of those brands, and I would see them start to expand outside their areas and start affiliating. And then I think a lot of current healthcare provision is going to mutate into a different area. So some people will end up in a more consumerized acute care, urgent care or more consumer focused way, and some will go perhaps into other areas, maybe into long-term care or find specific specialties. But I think the long-term, and it may be 15, 20 years away, the era of the horizontally integrated system in a region that does everything for everybody at very high cost has got to go away.
What about the health policy wrapping around this? I mean, there's clamoring for Medicare for all at this point. I mean, there's a lot changing with the Affordable Care Act, which has kind of like fallen to ruins. I mean, what do you think? What's that impact? Because this doesn't live in a vacuum.
Sigh.
Good answer, Matthew.
The real answer is that despite the absolute craziness of the Trump administration in virtually every area, in health payment, Seema Verma, who I have my moments and differences with, nonetheless has been pretty strong, suggesting that they were going to continue in Medicare doing bundle payment, moving to value-based care, which drives everything in this direction. So I think the horse is out of the barn. One administration is a blip. We'll obviously see what happens with the midterms and with 2020. I don't think this is the continuation of what started with the Affordable Care Act, not with the insurance piece, which will continue to be a massive war zone politically because of the way we are in the country. Right. But with the underlying bit about how we're going to do payment, that set a bunch of stuff into motion, not as fast as I'd like to have done, but set a bunch of stuff like ACOs and bundle payments into motion. And that, I think, is going to continue because we can't afford just straight fee-for-service. If Medicare for All was a serious thing and it became a fee-for-service program, it might derail some of this, but I don't think, there'll be a compromise there too. We'll see. That may be a big part of the Democratic plank in 2020, but even if it comes down to it, we're not going to get rid of all insurance companies overnight. We're not going to get rid of all private hospitals overnight, and so we'll see how that plays out. Not that insuring the rest of the Americans who are not insured wouldn't be a good idea.
Okay, so last question for you. So, you're advising startups now in your role as SMACK.Health, and you're doing a lot of great things there. And so what are you telling the startups that are working with you? Like, how do they plan ahead for this tech stack flipping and kind of, making sure that they take advantage of the climate as it's existing right now and taking advantage of the change and the shifting sands?
Well, I think the major thing that startups have to do is to understand where they're going to fit in the healthcare system of the future. Now, the good news is when you're a startup working with me, you're probably a relatively small one, and you're usually working on one problem. One or two are trying to do many more, and I can advise them to scale back. But in general, the goal is find something in all of this big mess. I'm talking about huge shifts in this, but there are particular problems that need to be fixed up and down the scale here. So find that one particular problem, figure out how you can fix that well with patients and with doctors, do that well and explain to the world how you're doing it and why you're better, faster, cheaper than the next guy. And that's usually my main advice. I'm not really saying you should be going out there and dealing with trying to boil the ocean, change the world.
No, but as far as integrating this new idea of the flipped tech stack, what should they do?
They should be prepared to understand how they fit into a bigger platform, which means looking at what the Amazons, Googles, and some of these CBS centers are doing and figure out how they fit into that world. Unless, of course, they want to become one of those, which is another much bigger ambition.
Well, it's not often I get to talk to you for more than 2 minutes. It's actually quite nice.
You said that just now?
I did just say that.
Oh,
I
I'm so
know,
thank you.
I know. Well, no, I was really curious about this flipping the tech stack thing because I heard you talk through it the first time at Health 2.0, and I really needed it broken down for me a second time, and it was much more understandable the second time because I was really, I really wanted to dig in on it.
That's because Indy didn't get a word in there.
Yeah, no, and she would have made sense of it for me.
She gave a great talk about this, which should be out soon at Mayo, where she's got into this in some more detail.
Yeah.
And we were rushing through it in 15 minutes for a
well,
new
of
concept.
course.
It's tough, but we have written a paper that's going to come out about it in the American Hospital Association Journal soon. So we'll be hearing. This is going to be our shtick for the next little bit. So you'll all be bored of this in a year and a half.
Fantastic! Can't wait for that. I'm Jessica DaMassa here with Matthew Holt. Thanks so much for watching WTF Health.